What is the Northern Nevada Alliance for Health and Justice?
The Northern Nevada Alliance for Health and Justice is a medical legal partnership between Northern Nevada Hopes and Washoe Legal Services. As a medical legal partnership, we provide civil legal services directly to patients of Hopes in order to improve their health outcomes. This program is innovative because we provide the services directly to the patients at a healthcare center where they're already visiting and they've already created a level of trust with the agency. Therefore, we're reducing the barriers to having to go outside of the agency, finding someone who is a potential person that could answer your questions, and instead we're just getting them done right here at the clinic where the patients are already visiting.
The Northern Nevada Alliance for Health and Justice is also the first and only medical legal partnership in the state of Nevada.
How does legal aid improve health outcomes?
So there's different ways in which legal aid can help to improve health outcomes. As we mentioned, MLPs or medical legal partnerships will generally try to address what we consider health-harming legal needs. These are legal needs that, as the name implies, are likely to affect someone's health. For example, if someone is facing eviction where they could potentially become homeless, obviously homelessness is something that can have a very disastrous impact on someone's health. So by focusing on these health-harming legal needs, medical legal partnerships work to try to provide legal assistance as a sort of intervention to try to either prevent someone's health from becoming worse or actively improving health. Other examples are, for example, if someone is losing some kind of government benefit, they'll be less likely to be able to afford healthy foods or to pay for doctor's visits. So our legal intervention in that instance would be to try to get the person their government benefit back so that, again, they can do those things that are going to help improve their health. And if I could add one more thing, one of the things that makes medical legal partnerships so successful is that many times the client or the patient themselves won't realize that they have a health-harming legal need, and so a lot of times if they're talking to their healthcare provider and they happen to mention something like, oh, I'm afraid of losing my housing, one of the things that makes this program so great is that medical provider can then turn around and say, well, we do offer free legal services right here in-house at Hopes, and if you're interested, I can put you in touch with that. And we do have an internal referral process where basically the patient or the client needs to do very little to get that help that they need.
Can you share some client outcomes that you guys are proud of?
Certainly. So in one case, we had an individual client who was transitioning out of homelessness. The client had substance abuse issues that they were in the process of treating, and they were actually doing really well, abstaining from substance use. And the first time they got into stable housing, within 3 days of getting that permanent housing, the landlord tried to unlawfully evict them. So in that case, we were able to intervene. We were able to go to court with the client. We were able to have a judge issue an order saying that the eviction was illegal, and we were able to maintain the client in their housing, obviously helping their ability to have stable housing, to remain sober, and to continue working on their health. Another case in which we had a great positive outcome was one in which the client came to us because they had been denied SSI. SSI is a government benefit that's given to individuals with disabilities who are also low income. So they're individuals with a financial need and suffering from a disability. In this instance, the client was very disabled. The client was suffering from brain tumors and other types of cancer and certainly couldn't work. And after about almost a year of appealing the denial of the SSI, we were able to get that client not only payments, but also the back pay, that where Social Security found that they should have been issuing those payments during those 12 months that it took to appeal the case. So the client received something close to about $17,000 in back payments, and obviously this had a huge impact because since they did receive SSI, in this instance there was only one adult child supporting the household. The money was then, they were able to use that money to help the disabled individual again take care of their health and just have a little bit more stability in their life from that government benefit that was wrongfully denied.
If someone needs help from the HOPES Medical Legal Partnership, how would one go about getting that help?
So there's a few different ways that you can access the Medical Legal Partnership as a client of HOPES. So if you're already a client, go ahead and ask your behavioral health provider, your case manager, or your medical provider for a referral to the Medical Legal Partnership program. We also do just take referrals directly. I'll take them internally. So you can contact me by asking the front desk. And we also do take referrals from Washoe Legal Services. So if you feel that your legal issue is affecting your health and your stability, you can contact Washoe Legal Services as well.